Thank you, Ernestina. I wanted to thank Nestle Foundation for organizing this meeting and the hospitality. It's been wonderful these past couple days, and very much have enjoyed the meeting. And I wanted to give a special thanks to Lydia for making our trip and our visit so smooth. So I'll be talking about the system science approach to the obesity epidemic and diabetes prevention. In many ways, this is trying to bring together many of the topics and conversations that have been going on over the past day and a half. Oops. This doesn't seem to be advancing. We hit this? Oh, okay, there we go. Thank you. So first of all, we want to highlight the fact that both obesity and diabetes is a systems problem. So what do we mean by systems problem? Well, first of all, as many of you know, obesity is a global epidemic. So it's no longer confined to a particular country or a set of countries, and it's not confined to a set of countries that have particular socioeconomic levels or characteristics. So it's really affecting over 1.5 billion people around the world, and it affects all regions in the world in all income levels. 65% of the world's population lives in a country where overweight and obesity kills more people than being underweight. And it affects all age groups, as all of you know. And it has very far-reaching consequences. So we've heard some things about the health consequences, psychological and economic, as well as social consequences. So this can cause a lot of concerns, not just in the future, but also in the present as well. So obesity really results from a set of intertwined complex systems. So here, this graphic tries to illustrate some of the major factors and relationships involved in obesity. So for instance, there's cultural effects, biological effects, behavioral effects, social network effects, environmental effects, policy effects, and economic effects. This is by no means a complete list. This just shows some of the key factors and relationships. So if you take yesterday's talks and overlay them on some of these different factors, I've tried to do this, but one of the challenges is, as you can see, many of the different factors are overlapping. So for instance, Dr. Herman talked about some aspects of biology, but those interrelate with behavior and culture. Dr. Mustafarian focused a lot on what we eat specifically, so that's related to behavior, but it's also related to the environment as well as social networks and biology. Dr. Spildener talked a little bit about the effects of the maternal experience, and that, of course, overlays biology, behavior, and social networks. Dr. Gittleson, Dr. Ewing talked about environmental factors, respectively, the food environment and the physical activity environment. But as you know, that intersects with policy and social networks, behavior, and even biology. And Dr. Hernandez Villa talked a lot about economics, but also policy, and then all those other factors were intertwined. So in many ways, this distinguished group of speakers really highlighted the fact that things are really interwoven. We really can't look at obesity and say, this is caused by this specific factor or this specific relationship. It's quite complex. Oops, this is going backwards. Okay, so what exactly do we mean by a system? Well, a system essentially is a collection of components that interact with each other and are bound to each other. So a system can be a system of people, it can be a system of organizations, it can be a system of objects or animals or what have you. But the key thing is each of these components do not exist in isolation. So they're all parts of a large lattice work of connections. So one of the key things to remember is if you affect one of the components or one of the individuals in the system, number one, you have to consider the effects on all the other components, all the other individuals. And also, you have to consider the effects of all the other components on that individual as well. So for instance, with obesity, you might make a lot of effort to try to convince an individual, well, you should exercise more, or you should eat better, you should improve your diet. But if you take that individual and place that individual back into his or her social network, his or her food environment or physical activity environment, his or her cultural environment, those things can be very difficult to change. The individual may realize that he or she needs to improve his or her physical activity or diet, but there are so many pressures and there are so many systems that are involved that affect this person that's really difficult. These things can be very difficult to change, even if the individual has good intentions and is very dedicated to change. So what are the dangers of not using a systems approach? So not considering the fact that this is all intertwined within a deeply complex system. Well, first of all, not considering the system leads to band-aids rather than solutions. So if you look at the far left corner, lower corner, when we say band-aids, we mean interventions or policies that may change one aspect of the problem, but they don't really change the underlying problem. So many times you might see a quote-unquote solution that works for a short time or works for a small sector of the population, but many times that doesn't last. So that second box over there, unsustainable solutions, is a problem. So you might say, okay, within a month or a year or even a few years, you might see a change, but then things can revert, things can change back. Worse, things can even get worse in the long term. So we have to look at both the short term and the long term. That top box over there says that many times we miss secondary and tertiary effects, meaning that if you don't consider the whole system, you might see an immediate effect, but you don't see the reverberations of the change or policy or intervention. Again, because people are connected. And sometimes these secondary and tertiary effects can occur immediately, or sometimes they can occur over the course of time. So again, you might say, well, this is great, this intervention is working, but can it really work over a long period of time? Worse yet, you could even have unintended consequences, which is that box over there. So there are many examples in which you make a change and you think it's for the better, and of course everyone involved in the change is well-meaning, but it can actually have the reverse effects. Like for instance, if you are trying to promote intense physical activity, that can lead to changes in diet. And sometimes those changes may not always be positive, especially if the physical activity is very intense and the person feels that they need to eat to compensate. So we could think of many examples where you can have these unintended consequences from well-meaning interventions. And finally down here, you can expend considerable time, effort, and resources from trial and error, meaning that if you try something, again, without considering how all the system is connected, and it may not have the effects that you think it might have, you've expended a considerable amount of time, effort, and resources in doing so. So it would be better to have an idea of how things might interconnect and the potential reverberations before you actually implement the intervention. So there are many examples of complex systems. In fact, almost everything that we encounter every day is part of a complex system. So yesterday it was mentioned some aspect of transportation systems, so it was mentioned the car safety, but transportation systems are very complex. Manufacturing systems, financial, ecological, meteorological systems, and aerospace systems. So many of these different fields and professions have long adopted a systems approach to their issues and problems. And I'll explain what that means when I say systems approach in a few slides. By comparison, public health and medicine have been a little slower to adopt systems approaches. But these fields are very ripe to be transformed by systems approaches. Because if you think about it, in many ways, public health problems such as obesity have a lot of the complexities that a lot of these systems have, and are good candidates to really address some of these issues. So one way to address systems and systems problems is the use of computational modeling, computational or mathematical modeling. So what do I mean by computational modeling? Well, when I say computational modeling, I don't mean that over there, modeling a laptop. I mean this type of modeling. Many times when I tell people that I am a modeler, people look at me and look at my clothes and say, "Are you really sure that you're a modeler?" And I explain, of course, well, it's the less fashionable kind, which is with computers. But modeling can really help understand and address complex systems. So what is modeling? Well, modeling is essentially taking some type of process, situation, system, or decision, and developing a computational representation of that situation, process, system, or decision. So is computational modeling really very different from what we do? Well, actually, if you think about it, we model many times every day. So every question, every consideration, every decision that we have each day, we actually model in our heads. So what should I eat? How should I get to work? What should I wear? What should I do? What should I purchase? Should I go to the gym? Should I listen to this lecture? Should I ignore this lecture? All of these things, we actually unconsciously or consciously model in our heads. So we sit there and say, okay, so for instance, if we take the example of, should I listen to this speaker right now? Well, you think in your head, well, if I do listen, this is what I potentially can gain, but this is the cost of listening. If I don't listen, well, maybe I can think about something else and maybe that has a better outcome. So you think of all these different things when you're actually making a decision. But we don't really consciously think about it because many of these decisions are very snap and our brain is very complex. But essentially, what computational modeling is doing is taking a lot of these processes that are currently going on in our heads and putting it out in a computer or a piece of paper or chalkboard or what have you, so that you can really see how you're making these decisions, how you're considering the system, and not just you, but other people. So it's a way of everyone seeing what's our understanding of the system, what do we think are the relationships that are at play, and how do those things interact. So it's not an arcane science. It's not something that's very distant. Say, oh, well, that's in the clouds, or that's a unknown box. It's actually taking what we do every day and really using some of these mathematical and computational techniques to represent that. So an example is meteorology. So all of you have probably seen weather maps or weather forecasts or what have you. And as you know, of course, the weather forecasts can vary. But those are every weather map or weather forecast or understanding the weather is the product of computational modeling or a simulation model. So if you look at the weather map, they try to generate the forecast based on the air and ground temperature, based on the terrain, the wind patterns, the cloud configuration and movement, the barometric pressure, the ocean wave and temperature, all of these different diverse sets of data. And they all have to be integrated and connected to give you the forecast, or to give you the understanding of weather patterns, or to tell you where hurricanes are going to appear, or how are tornadoes going to track. And so all of these complex things are very difficult to digest and process just with a single human brain. So you really need a collection of quote unquote brains to really do this. And that's why simulation modeling has really transformed meteorology. Nowadays, we don't make any decisions in weather without using computational modeling. And many of these data elements are either variable or in some cases difficult to find. So it's very analogous to the situation in public health and obesity issue. So some of the data is very available, some of the data may be hard to get, and some of the data we're not even clear about how to get. So it takes all these disparate elements and puts it together in a model. So modeling can really serve as a bridge to translation in many ways. So the one thing I want to emphasize is computational modeling does not replace other types of studies. Instead, it actually enhances and facilitates and helps guide many different studies. So one concern that some people might have is, oh, well, you're going to build a simulation model. Will that replace me and my decision making and what I do? Well, absolutely not. So simulation modeling, as we've seen in many other fields, has actually helped enhance a lot of other methodologies and studies. So for instance, if you look at this whole continuum of going from a need or idea to policy and practice, modeling can help design different type of retrospective and prospective studies. It can help guide what data is actually needed. So you build a model and you say, okay, I have all these different inputs to build this model, but I'm really lacking on these inputs, and I think based on my initial simulations that these inputs will really make a big difference. So it helps you prioritize data collection. You know, one of the challenges is many times when you approach an issue or a problem in public health, the first instinct is to just collect as much data as possible so that we have lots of data and figure out what we do. But sometimes that can be very costly and time consuming. So a model can help guide prioritizing this data collection. And then you have retrospective studies which have a lot of strengths, but also have some limitations. So data availability, it might be a problem. So you can help, you could build a model to help guide data collection or help bring data sources together. Generalizability. So for instance, if you do a study in Mexico City, does that apply to other locations within Mexico or other cities outside Mexico? Does this apply to Los Angeles or London or Tokyo? So you can develop a model based on data from one location and see if it applies to other locations. And granularity is an issue. Many times we don't have from a particular study the level of detail data that we might need to make a decision. So you can use a model to help adapt some of that data and see how that might affect things. Similarly with prospective studies, it faces a lot of the same challenges. In addition to that, prospective studies can be very expensive, so you might want to plan the prospective study with a computational model before you invest the expense. And you can also have ethical and legal issues. So I've done a fair amount of modeling in infectious diseases, and as we all know, it's hard to get a study approved where you will release an infectious disease and see what happens. So instead, sometimes you can use a computational model to see what that happens, to see the potential effects and test different policies and interventions. And this applies to obesity as well. So what is a systems approach? Well, a systems approach is really a very iterative process. So it's not a single, let's build a model, okay, we've done the model, and we're all finished. No, instead, it's this cycle in which you first convene multidisciplinary teams, so that's in the upper left-hand corner, and then you can, the team collectively can create these mathematical and computational models to represent the system of interest. So for instance, if you want to look at a particular school or a particular city or a particular community, and you want to understand what's the situation in terms of obesity prevention and control, what's the potential impact of an intervention, well, you create this model to represent that. And then that can help elucidate important factors in relationships, which can help guide and prioritize data collection, and it also allows you to test different policies and interventions, and I'll show you an example later in this talk. And then all that information can help inform stakeholders or key decision makers. And one thing I want to emphasize is it's very helpful to get decision makers involved in this process as early as possible. Because one of the challenges is sometimes when you develop a model and you show it to someone else, and if they don't understand how that model was developed, and if they don't understand all the assumptions and issues that went into building the model, then they either may not trust that model or they might not know how to interpret it. So if you get decision makers fairly heavily involved in the model building process, that can help achieve ownership, joint ownership of the model. They feel, okay, well, I help contribute to building this model, so I understand what goes into it, so I'm more likely to trust the results. And also, they can offer very key insights, because another challenge is you can have a model that's built over here by one group of people, and then you can have reality or real life, and you have decision makers over here, and the model may not actually represent their key concerns. But if you get them involved very early on, then you can make sure that the model targets the actual decisions that are important, and the results are practical and can actually be implemented. So with all of this, you design and implement interventions, and through all these processes, including data collection and testing the model and testing the interventions, that gives you additional data which you can use to update the models. So this keeps going in a cycle. So you take a model, and the first model may be very rough and very general, but you keep refining the model as you move along, and that model becomes more and more useful in terms of making different types of decisions. So I just wanted to say a few quick things about our Global Obesity Prevention Center, because we're really dedicated towards the systems approach to the obesity epidemic. So we feel that this is a global problem, and being a global problem, it requires a global approach, because all of the different countries around the world are really getting very interconnected through travel, through communications, through the spread of social media, the internet, all those different things. So it's very difficult to look at a single country or town or city in isolation. We're really very, very connected. So what happens in Mexico is very, very important to the United States, to countries in Asia, to Europe, and vice versa. So we're all very interlinked. And so understanding what's happening in different countries is very important to each country and each individual, and can help achieve real system solutions. The systems approach also involves convening a broad array of disciplines, including those that are not traditionally associated with obesity prevention and control, and taking them and connecting them with people who have a very deep understanding of obesity and diabetes prevention and control. This creates a mind meld where you're essentially bringing new ideas, new approaches, combining that with very deep expertise and producing new solutions and approaches, such as computational tools and social media. And it's very important to bridge research, education, and policy and action. These are not separate things. The research has to match what's needed in the policy arena and what's needed in the decision-making arena, and they can also help inform the research and vice versa. And education is very important because we need to train the current generation of decision makers as well as the future generation of decision makers. I give you an example of a systems approach that was successful in the US, where in developing the space program, NASA not only relied on aerospace engineers or rocket scientists, but they also brought in psychologists, sociologists, economists, other disciplines, because they realized that these were very important in making a real successful space program, because there are a lot of considerations, like psychological considerations. For instance, you're taking astronauts and you're placing them up in space where they have to deal with separation from their social networks. They will experience different physical changes while in space. So if they can't adapt, it doesn't matter how powerful or how modern your rockets or space shuttles may be, the program is at risk for failure because you don't have certain components in place. So that's why they understood that, and we're advocating using a similar approach to tackling obesity. Our GOPC is university-wide, including the School of Medicine, School of Public Health, School of Engineering, as well as the Business School. And here are some of GOPC members. I want to highlight a few folks because I actually had our agent-based modeling team, but didn't make it into this deck. But Joel Gittleson, Joel's right down there, and he's also over there. So he described our Baltimore project, and he's been leading a lot of our efforts in developing an agent-based model of Baltimore, which I'll explain in a few slides. And Eli Louise is right in the middle. And she is the coordinator of our agent-based modeling team, has really been pushing efforts forward. And also Takagusa, who is right over there, right next to Eli. And he's a professor of engineering, and he has long, deep experience in system science in many different fields, and he's been very instrumental in developing our model as well. And I forgot Sen Lin, which is right above Eli, and he's been doing a lot of the programming. So let's take an example of a system science approach. So the virtual population laboratories basically are these simulation models of a community, a town, a city, where we represent all the key aspects of that city or location. So if I don't know how many of you are familiar with SimCity or SimEarth or Second Life, some of those simulation models. It's very akin to that. So we've developed one for Baltimore. It's an agent-based model. When I say agent-based model, we have these computational agents that represent people. So they're basically virtual people with different characteristics, like a gender or an age or a food preference or a body mass index. And then we have virtual representations of different homes, schools, and food sources and physical activity locations. So, for instance, in our virtual Baltimore laboratory, one part of that is the BeLife model, which Joel mentioned yesterday, which is a representation of some of the lower income neighborhoods in Baltimore. This is what happens. We have these virtual representations of homes and schools and all these food sources and recreation centers, and we have many different virtual people moving from these locations each day. So they go from home to school, and then after school they say, well, should I eat in a carry-out restaurant? Should I go to a corner store or a grocery store? And then they'll consume a certain number of calories depending on what that location is stocking, and they might go to a recreation center, and then they'll expend calories because of physical activity. And throughout this whole process, they might be walking to different locations, and during the walking, they can expend calories as well. And then within each computational agent is a metabolic model. So that agent will take calories in, and this metabolic model was developed by Nancy Butte and her colleagues at Baylor. And it will take calories in and then measure the calories out based on physical activity, and that will determine each day how that child's or person's body mass index is affected. So, and here are some of the calculations. I won't go through that in detail, but I'd be happy to answer questions about it later. And each food source has a healthiness score, and that's based on the store infrastructure, store owner training, the food and beverage prices, the promotions that might be occurring then, as well as the composition of inventory that that food has, the composition of healthy versus unhealthy foods. And then the agents, or each of these virtual people, have fairly complex adaptive behaviors. So each virtual child might start off with a healthy food preference, and if they go to a food store and that food store has a lot of healthy foods, well, the next time or the next day, that child may be more likely to eat healthy again. The reverse is true as well. So if that child eats unhealthy one day, that child may be more likely to eat unhealthy the next day. So again, this is a representation of an adaptive behavior. And then based on these calories in and calories out and this metabolic model, that's overlaid on top of standard CDC growth curves, and that will determine whether the gain in body mass index is greater than what's expected with the growth curve or less. And so essentially you have these daily perturbations based on calories in and calories out of each child's growth curve. One of the things that we're also doing is we're working to incorporate a synthetic population, which was developed by RTI in North Carolina, where essentially have taken US Census data and they've created this virtual population of the entire United States that's actually assigned to households. So in theory, each person within the United States is represented by a virtual person. And then from that, we can extract Baltimore. So with all of that information, we can create the simulation model, and we'll see if this works. This is a graphical representation. And as you can see, you have all these virtual kids moving from home to school to different food sources and physical activity locations. And that's based on a lot of the algorithms which I described previously. So that's a visualization just to give you an idea of what's happening. And if you recognize this map from Joel's talk yesterday, this is a representation of the central part of Baltimore City. And in particular, we focused on places that have been evaluated as food deserts. So let me give you an example of how we can take an intervention or policy and test it in this model. So for instance, we looked at the impact of a staple food ordinance. So that's a requirement that each store has to have a certain quantity of staple foods, such as produce, protein, and dairy. And this was actually, an ordinance like this was actually recently implemented in Minneapolis. So these are some of the parameters, and one of the key things is building this model went very hand in hand with the data collection and the studies that are occurring in Joel's Baltimore project. So we actually have real data from Baltimore that we can use to populate or calibrate the model. And here are some examples of that data. And I think Joel might have shown some of this yesterday, but this is a visualization of the BeLife model where you essentially have that visualization there. You have number 3 shows all these different levers that you can change. So you can change different characteristics in each of the virtual children or the different food sources or different locations and see how it affects the model. And this dashboard, labeled number 4, shows you the results after you did the simulation runs. So this is a very quick general summary of some of the results. So you can see these 3 different lines. You can see the x-axis is time in years. So we ran this simulation over a number of simulated years. And then the y-axis is the BMI percentile. So this first curve, the very top curve, shows what happens to overall BMI percentile when you have no staple foods policy in place. The lower curve shows what happens when you implement the staple foods policy. We're assuming 100% compliance with the staple food policy, but we can also alter that as well. So you can see there's actually a drop over time in the BMI percentile for the population of children. If you add in-store promotional signs, such as posters, shelf labels, interactive sessions to promote healthy eating and healthy food decision-making, then you actually get further gains represented by that black curve. So this suggests that if you do implement a staple foods policy, then you will, over time, see benefits in the average BMI, the BMI percentile of the population of children in Baltimore City. And of course, we can run multiple simulations where we adjust different variables and factors and see how robust these results are to different types of assumptions. So that's a quick example of using simulation modeling to assess a particular policy or intervention. So in summary, obesity is the result of many different complex systems. So there's not going to be a simple cause and effect relationship as I think we've all found and know. So these systems approaches have really transformed many other different fields. So we feel that obesity is a field where the time has come to really take some of these techniques and help try to transform the battle against obesity. Systems approach involves convening disciplines that are not traditionally associated with obesity, with those that are, creating these iterative collaborations with stakeholders, bridging research, education, policy, and action, and really taking a more global approach. And when we say global, it's not just looking internationally at the world, but even locally, you want to look globally. Like what's involved? What are the industries, stakeholders, and how do we bring them all together to really find win-win solutions? So it's not necessarily, it's not a necessity that we have a solution that will benefit this group and harm this other group. There might be solutions where everyone benefits. And we can use modeling and systems approach to really try to find some of those potential solutions. So we feel that a systems approach could really transform obesity control as it's done with other fields. And we're at the cusp of sort of a new era in really assessing how we can address obesity and diabetes control. So with that, again, I wanted to thank all of you for listening. Hopefully you made the decision to listen to my lecture, but if not, that's okay. Again, and I want to thank the Nestle Foundation for really assembling a very distinguished group of speakers. I've certainly learned a lot over the past day, and I anticipate learning a lot more for the rest of the day. And I think all of this definitely highlights the fact that we're drawing from so many different disciplines and so much expertise, highlights the fact that this is truly a systems problem, and it really depends on a systems approach. So thank you.